Hey, what's up everybody? This is Dr. Andrew Kim, MD. I'm a board certified psychiatrist, and today's video is on myths about addiction. That's right, even in this day and age, with all of the advances in addiction medicine, psychiatry, with all the information about wellness that's out there on the internet, there are still so many common myths, misconceptions, and misperceptions about addiction and addiction recovery. So let's go through a few of the common ones that may be serving as an obstacle or discouraging thoughts for yourself or thoughts you may have had towards others and need to kind of recalibrate. Myth number one, addiction is simply a choice. It's not a disease, it's not a disorder, it's a choice. Why can't people just make better choices? People will go on and on various internet videos debating, is addiction a disease? Is it simply a choice? Is it a moral choice? Is it a moral failing? This is how I'll simply put it, without getting into medical journals and all the jargon. At one point, yes, an individual made a conscious choice or decision to use a substance, a drug, alcohol. But then, in my humble opinion, a disease can kick in. I don't know that someone consciously and volitionally says to themselves, I choose to want to suffer. I choose to want to feel powerless and hopeless repeatedly, day to day, week to week, month to month. I don't know that any of my patients chooses to say, put me through months and years of this cycle of suffering and torture. I just choose to do that because it's fun. I choose to ruin my life and feel powerless at times. When I put it that way, I think it's pretty clear. No one simply chooses addiction, in my opinion. Myth number two. Treatment is hopeless or pointless when it comes to addictions. Look, I or my loved one keeps relapsing. We've been through treatment so many times. We've done detox. We've done these interventions. It keeps happening. Treatment is pointless. This almost promotes the myth that somehow I was just born this way, that this is part of their personality. This promotes learned helplessness. This promotes both clinicians and patients to grow apathetic. Here we go again. 9th visit to the ER. That's Johnny being Johnny. Okay? This almost promotes a stigma that still remains to this day about addiction recovery and addiction treatment. Imagine if I took the word addiction or substance use disorder out of it and I put the word diabetes to replace it. And I said, hey, look, Johnny, he had really good blood sugar control for many years, and now weird, blood sugars are out of control. I don't think the reaction would be, I guess this is pointless. Man, I don't know. We've been helping his pancreas with insulin for a while. This is frustrating. We might as well just give up. This is hopeless. No, the physician and the doctor or the clinicians would say, well, what do we do? Do we need a new insulin regimen? Do they need new oral medications? How do we adjust their regimen? What's going on, right? So I think there still even exists this stigma, and we treat addictions differently than we would for other chronic conditions, other relapsing and remitting conditions. And this is a myth we have to get away from. Treatment is not hopeless. Treatment is not pointless. We've come a long way with different types of therapies, different types of counseling interventions, different types of specialized intensive programs, medicines that can complement these things. Treatment has come a long way. Addictions treatment, addiction recovery is not hopeless nor pointless, even when there are relapses and setbacks. Myth number three, addictions only happens to those people. Addiction doesn't care about your skin color. Addiction doesn't care about what degree you have or don't have. Addiction doesn't care about your socioeconomic status, how much is in your bank account, or what neighborhood you live in. This myth may also imply some kind of moral failing. We're a good family. That kind of stuff doesn't happen in this household. It only happens to bad people, those people. Sorry. Addictions can happen to anyone. Addictions is one of the least racist, least discriminatory entities out there. Addictions is relevant to everyone, to you, to me, can happen to anybody, guys. Myth number 4. I can't be addicted. I'm high functioning. I still go to work. Our society has created a narrative in the media, in film, TV, that somehow we need to hit this rock bottom. Right? I got to be living in squalor. I've lost everything. I lost my home, my condo. In order to truly be ready to change, in order to truly be ready, to get help, right? Now I'm going to have this comeback narrative, right? I'm sorry. Plenty of folks go to work, go to school, put on a smile on their face, yet are secretly and silently struggling with addictions every day. Every day. Okay? Waiting to hit rock bottom, that's a dangerous stance. Okay? Tragically, in some cases, rock bottom might equal losing your life or losing your loved one's life. Right? It's not funny when I put it that way, right? Rock bottom can be dangerous when it comes to addictions. Addiction recovery for you or a loved one can start at any point. It's never too soon. Myth number 5. Addiction treatment, addiction recovery treatment is only possible if I'm super rich. I need to go away to a super expensive residential program or retreat like all those celebrities do. Now look, I'd be lying. Does having money and resources help? Of course it does, right? I'd be stupid to say otherwise. Doesn't mean you have to be rich though. Doesn't mean you have to be a celebrity where you go to some retreat center where you have a personalized chef and you're doing yoga from some renowned yoga instructor. Cut all that crap out of your mind, okay? Most addiction recovery, the vast majority of addiction recovery occurs in office settings across the country, okay? Seeing your therapist, talking to a counselor who specializes in addictions, doing some motivational interviewing to getting you through your ambivalence, okay? Prescription medications from a family medicine doctor or psychiatrist to treat comorbid problems that might be feeding into addictions, depression, anxiety, ADHD, all right? There are support groups out there. There are medications to help reduce cravings for harm reduction. There are medicines that can replace illicit opioids like heroin, methadone, buprenorphine. There are medications to reduce alcohol cravings, naltrexone, acamprosate. There are support groups. There are support groups for family members. This is what I'm talking about, okay? Don't let TV and reality series convince you got to go on some fancy retreat. Most of the work is done in the trenches in our communities. Hospital clinics, private practices, community mental health centers, okay? Even telehealth to some degree at this point. Myth that you need to be super rich. Does having money and extra resources help? Of course. But not being super rich or not being a celebrity should not stop you from getting started in seeking help for yourself or a loved one. The final myth I'm going to go over is that there's nothing I can do, and addictions is not my problem. I'm not addicted. Here's the reality, guys, okay? Addictions is likely affecting a friend, a coworker, family member, your children, your parents, your siblings, someone you know, someone in your community. Addictions not only affects that particular individual, it affects their loved ones, it affects people in their inner circle, the community at large, okay? Addictions affects all of us in some shape or form, even if it's basic as the tax dollars you're spending to support resources in the community. To say that addictions is not a me problem means somehow, I guess, you're not connected and part of a community. Okay? And there are things you can do. You can educate yourself. All right? You can better understand generally the concept of addictions and addiction recovery. You can stay connected with your loved ones and people in your life. Check in on them. You don't have to be an addictions expert. You don't have to be the one doing the therapy. You don't have to be the one telling them what to do. Just say, how are you doing? Hey man, I see that you're struggling. You want to talk to me? Maybe we can figure out how to get you help. If you're ready for that, maybe we can Google it together. Let's talk to someone who might know what direction to point us. Okay? You can help be an advocate. You can use your power of voting to demand better resources in our communities at the state level, at the national level, because we need more. And we need more resources. We need better access. We need to give a damn about each other, guys. All right? So hopefully this was helpful to work through some of these myths. Some of these are thoughts maybe you're struggling with right now. Maybe you've heard from someone else and you found it discouraging. Maybe you've said it to someone else. Okay, well, let's all learn together. That's what this is about. Hopefully this was helpful. Again, this is Dr. Kim. Hope you are all doing well. And of course, remember this, guys. You are worth the fight. You are worth that effort. You are worth pushing forward every day.